Hello, viewers. Today we have with us Dr. Himani Narula. She's a development and behavioral pediatrician, and the co-founder and director of Continua Kids. Welcome, Dr. Himani Narula.
Thank you.
We are glad to have with us. So today we'll be asking you some questions about the challenges that children face and something more about their parents and all.
Yeah. Thank you so much for having me on your channel.
A pleasure is all ours. So, tell me, what is the age at which a child screening should be done for various mental challenges that a child can have? What is the age after the child is born? How
Yeah.
soon?
So, a newborn, there are three kinds of screening which can be done. So, one is the newborn screening, which is screening which can be done using a blood test. Then there is a
Mm-hmm.
hearing screening, and then there are developmental behavioral screenings.
Mm-hmm.
So, the age for each of these kinds of screening is different. But
Mm-hmm.
the moment a baby is born and their feeding starts in 3 to 5 days, you can do a newborn screening, which
Okay.
pull out a lot of metabolic conditions for the child. And it's important for us to know that there are 25 million newborns approximately born every year in our country. And
Okay.
out of them, about 5 million children die in their first month of life, um, especially because of various newborn metabolic errors and
Okay.
or some kind of a congenital abnormality. So
Hmm.
if we do a large population based newborn screening for these genetic conditions soon after birth, like between 3 to 5 days of their life, then it can actually identify them early. We can give
Hmm.
them early intervention, we can prevent disability and death, we can do family counseling, we
Hmm.
can do prenatal diagnosis for future pregnancies, and
Hmm.
can also avoid a lot of frustration for parents who are dealing or struggling to find a diagnosis for their child as to
Hmm.
why there is a challenge. Now, that
Hmm.
is newborn screening, which is for metabolic and genetic disorders. Then comes the
Hmm.
hearing screening. So, one in 4,000 babies born, approximately one of the baby will have some kind of a hearing impairment, congenital
Hmm.
hearing impairment, which can lead to delay in speech and then language and then their communication. So it's again important that that screening can be done at birth within again first 3 days of life. As soon as the baby is born, in the first 3 days, a newborn screening is a very basic, simple test, can be done by a technician also who's
Okay.
trained to use the machine. So that should be done for all infants, because screening them early, you can treat them before 6 months, before their word count starts appearing. So before 6 months, we must be able to identify and start intervening a child with hearing impairment. So it's important to screen them right at birth.
Okay. So
Then,
there's okay.
then
Okay. Go
comes
ahead.
to behavioral screening. So that
Mm-hmm.
starts as the child is growing. A continuous monitoring of their developmental milestones is important. And
Mm-hmm.
when we talk of something like autism, which is as common as 1 in 100 babies born in our country, we must do a mandatory screening. We have a screening tool available for all children from 16 months to 24 months of age group. So we can use that screening questionnaire and screen all babies at that age to identify them early. And yes, tracking of milestones definitely help us in a big way to identify developmental and behavioral problems early on.
Okay. So coming to the congenital issues that a child can have,
Hmm.
can't these be detected while in the fetal stage?
Yes, some of them can be detected, but there
Mm-hmm.
are certain conditions like inborn errors of metabolism and
Mm-hmm.
like congenital hypothyroidism, adrenal dysplasia,
Mm-hmm.
phenylketonuria. Some of these conditions, they can also be screened immediately after birth. Once the feeding starts, then the
Mm-hmm.
metabolic conditions, they start appearing. Then those blood levels of various enzymes which are deficient, they
Mm-hmm.
tend to pop up, and then it is possible to identify them. So there are certain conditions which can be identified as early as at within first week of birth.
Okay, and those can be corrected. The issues can be
Yeah,
tackled.
some conditions can be managed, and developmental delays as a result of those can be
Hmm.
prevented by doing some modifications and interventions and modifying diets, or withdrawing something from the food, or providing some kind of
Okay.
a early stimulation, so you can improve the quality of life and reduce disability significantly if you find them and identify them on time.
Okay. And another thing you said that autism is 1 in 100. That is
Yeah.
quite a huge thing.
So, yeah, there was one of the studies which was done by Inclin Trust in association with All India Institute of Medical Sciences, New Delhi,
Mm-hmm.
and that research was is well published, and that states it was conducted in 5 different states. Huge data was collected, and it states that something like 1 in 100 babies. One of the 100 child can have can be on autism spectrum, which is quite a significant number, and that is why it's very important to raise awareness that people are
Mm-hmm.
aware, and they can be children can be identified early, and even parent training can be initiated immediately after birth, so that the parent know how they need to do and what is the right thing to do for the better development of their child,
Hmm.
even
So,
before these
uh-huh.
conditions start appearing, what they can do as a parent.
Yeah. So that means among all the mental challenges that a child may have or can have, autism tops the list.
Yeah, kind of, you can say autism. It's not a mental challenge, we will say it's a
Huh. Uh-huh.
neurodevelopmental disorder, and
Okay.
we don't really call it like, it's not a chromosomal abnormality, it's not a disease per se. It's a
Okay.
neurodevelopmental uh, problem, and
Hmm.
in the way the child is learning is different. The way the
Hmm.
child will acquire, there can be a certain segment of children on spectrum who can have a lot of impairments and can lead to disability, but if we intervene them early, we can nip a
Hmm.
lot of problem early on, and we can reduce the percentage of disability for
Hmm.
them.
Okay. And what is the reason behind? Why is autism so prevalent?
So autism, initially in early years, like a few decades back, was more of a problem which was identified in United States,
Hmm.
and they started doing the screening, and they have seen in last few days the CDC data says that there has been an increase in the number of children being identified on autism, and similarly in Indian context, as we are practicing, we now have a unique disability identification number by the government, and a website where people can go and get themselves registered. But earlier on, we had no registry. So we are yet
Hmm.
to know what is the statistics and how over decades autism has increased or decreased, or what is the status. But to what we
Hmm.
experience clinically, we see a lot of children with these neurodevelopmental challenges where there are difficulties in socialization, difficulty in communication, and symptoms of autism spectrum. So
Hmm.
the reason behind, as you asked, is a combination. We call it epigenetic factors. There are
Hmm.
some genetic factors. There are some environmental factors, and these factors put together lead to epigenetic origin of these kinds of neurodevelopmental disorders. But we do not have a single factor which we can point out and say that this is the sole cause of autism and this is why autism is increasing. It is multifactorial.
Okay. Okay. Also, it can be something to do with the detection because maybe earlier, not many cases were detected.
Yeah, so people were not aware, the medical professionals were not so tuned in. Children
Hmm.
were the major health concerns were more of infectious diseases than developmental challenges. So the whole
Okay.
focus of the healthcare was more at preventing infectious diseases. We were
Hmm.
working at immunization to prevent those infectious diseases, but now when the children
Hmm.
are getting saved from early prematurity, from low birth weight, from infectious diseases, they are living a little longer, and more number
Hmm.
of children are living longer. So we want to now also focus at their development, and
Hmm.
so the healthcare and the doctors and everybody's focus has gone towards the
mm,
developmental challenges that we experience in our children,
mm,
and that's
mm,
why awareness has increased, training has improved for doctors.
mm,
So we
mm.
are identifying them also a little more than what
Okay.
we used to do earlier on.
Okay. So apart from autism that you cater to, what are the other challenges that Continua Kids is dealing with?
So we deal with any kind of neurodeviance from the typical development from
Mm-hmm.
birth to 18 years of age.
Mm-hmm.
So in early years, yes, there can be physical developmental like cerebral palsy. There can be any kind of a syndrome leading to developmental delay. There can be global developmental delay. There can be autism spectrum disorder. There can be
Mm-hmm.
ADHD, attention deficit hyperactivity disorder, learning disabilities, secondary to either intellectual disability, or there can be specific learning difficulties like dyslexia, dysgraphia, dyscalculia. Then
Mm-hmm.
there can be some kind of middle school behavioral concerns and mental health challenges. Like they can have some children can have problems with poor academic performances are there, which could be secondary to behavioral issues. So any behavioral issues also, if children
Mm-hmm.
have in the middle school,
Mm-hmm.
dealing with peer, dealing with the academic pressure, any kind of a in teenage, then we also tackle a lot of depression, obsessive compulsive disorder, learning difficulties, associated mental health condition, anxiety, panic attack. We have a psychiatrist also on our panel. We have a pediatric neurologist. I'm a developmental pediatrician. So we try and cover all the areas which are related to the mental health, right from child newborn period to 18 years, covering the teenage also,
Mm-hmm.
so that um, the whole pediatric age group is covered when it comes to neurological, neurodevelopmental, behavioral, and mental health concerns.
So that means mental health concerns when you're talking about it is also you also deal with the normal kids per se,
Yes,
normal
absolutely.
kids.
Absolute. Even parenting,
Mm-hmm.
sometimes parents with younger kids in their early toddler age group also come to
Mm-hmm.
us with various behavioral problems like extreme temper tantrums, thumb sucking
Okay.
issues, behavioral problems like aggressive behaviors, not settling in school, otherwise developmentally okay. The
Mm-hmm.
family is not able to manage certain behaviors. So those type of counselings also we do, hand holding
Okay.
the parent in various routine parenting challenges.
Okay. Coming to thumb sucking, is that an issue? Is that an actual issue, or it's just a small thing? Because I've seen many kids doing that, and they leave
Yeah.
with as they grow up, they leave that.
So that till that age it is acceptable, but if it
Mm-hmm.
continues after 3 years of age, then it needs to
Mm-hmm.
be intervened and it needs to be taken care of, because
So
it can lead to various problems with their
uh,
oral dentition, with their feeding,
okay.
with
Mm-hmm.
their teeth, and it can actually then continue to be as a habit for a long time, leading to various making them more prone to upper respiratory infections. Their
Okay.
dental growth may get disrupted, but that is
But
needs to be treated after 3 years of age. Till then, we do not typically consider it as a behavioral problem.
okay, okay. And what sort of physical and mental activities that you undertake for the children of different age group? What are the like? I want to know. You must be doing at your center certain
Yeah.
things, but as a parent, what a parent can do at home.
So subs important, and the most important thing for parent is to be responsive. Responsive
Hmm.
parenting is the first step. Whenever a baby is born, whatever the child does, you have to
Hmm.
acknowledge, look at it, and respond back to the baby uh, in some form or the other. Just don't ignore whatever the baby is doing. That's
Okay.
first thing. The second is about physical activities. It varies from age group wise. If a child,
Hmm.
how old is the child, depends on that what kind of an activities we are going to select. But
Hmm.
for a small toddler age group child,
Hmm.
like we are tracking the milestones, and as per their milestones which are expected to come, we will do activities which can stimulate those milestones and help them come on time. So
Mhm.
there, for a toddler age group, you can use ball, you can use walking, running, climbing the stairs up and down. They can kick a ball, they can throw a ball, because it also involves hand eye coordination, and it involves foot to ball and foot to eye coordination, that they have to kick with a certain strength. Then target hitting activities can be done for them. They can do some fine motor activities, jahan pe beading activities hai, or clay activities hai, where they're using clay, they're using puzzles, small small puzzles to fix. But all these things the child cannot be doing alone. The parent needs to be responsive, has to interact, engage with the child, so that it can build a certain kind of a bond with the child. And at the same time, parent is using that time to build social skills and communication skills for the child. So
Mhm.
that kind of a responsive parenting is extremely important. We can
Mhm.
provide them a whole set of toys, but if
Mhm.
there's nobody who's playing with them, engaging with them, seeing their response expressions to the toys or to the stuff, it can be a doll, and not engaging the child or giving them soft cues as to how to play with it, the child will not learn.
Mhm. Mhm.
That
So
kind of a
consider
responsive engagement is important.
Okay, so considering these days we have many nuclear families, and parents are both the parents are working and they don't have much time for the child. What kind of help can a parent give to the child? Like you said, that involvement and being
Yes,
responsive, being there for
yes.
the kid. You have to be there physically there. So if both the parents are
Even
working, what do you suggest to them?
Yeah, so when both the parents are working and the child is, so they, I'm sure, even if they're working for 8 hours in a day or 9 hours
Mm,
in a day, they'll get at least an hour per day to be able
mm,
to spend with their child.
mm,
Whenever you have a baby, you have to be mentally prepared to be able to
mm,
rear the child. We
mm,
are just not, as parents, we are just not giving birth to a child, but we also take the whole responsibility of their growth, their development, them getting and growing up into a responsible adult. So there
mm,
we need to devote some time from our life, very
mm.
very professional life, at least
Mhm,
1 hour, or maybe when you're changing diapers, when you're giving them a bath, when you are feeding them, instead of
mhm,
putting them in front of a TV screen, which is very,
mhm,
very detrimental for the baby. It's important
mhm,
that you do the responsive activities at that time. Even while
mhm,
bathing, you can engage, you can play with your child, you can teach them, talk to your child. So they say you need to speak 21,000 words a day with your child
okay.
from the 28th week of gestation, when the baby is inside the womb, till 2 years of age, for their language to develop adequately. And for that, we need 3 hours of talking. 21,000 words mean 3 hours non-stop talking with your baby.
That's quite something.
Yeah.
That's quite something.
Yeah. So even if every parent, like father devotes an hour, mother devotes an hour, a grandparent or a caregiver devotes an hour of responsive caregiving and talking and communicating, the child
Mhm,
will learn language, will not
mhm,
come in delays then.
mhm. Coming to TV, I've seen many parents like even while they are feeding the child, they'll switch on the TV, and I've seen like whenever I pointed out कि switch off the TV and feed, they will say कि otherwise वो खाना नहीं खाएगा, and this is
Right.
happening like in my family.
Yeah, everybody is doing that because it's a very
Uh,
easy way. The child gets distracted to the TV screen, and now it's easy. Whatever you're putting in their mouth, it goes in, and it saves time for the parent. But here, the
mhm,
parent is not realizing that the child is not eating sensorily. The child
mhm,
is not seeing the food, the color of the food, the texture of the food,
mhm,
the smell of the food, and is not able to respond back to you and tell their preference, their taste preference, whether they like that food, they don't
mhm,
like that food, and how much they want. They can't identify if they're hungry, they're not hungry. They're just
mhm,
being, the food is being put in their tummy. So
Hmm.
later on, this goes on. The child does not realize that what
Hmm.
kind of a food texture needs to be chewed, what can be swallowed. They are swallowing everything, and then
Hmm.
parents come to us later on saying that my child does not chew food. He started going to school, but he's not chewing food. My child is not speaking enough. So this whole oromotor system, which needs to get activated, is not getting
Hmm.
activated because of that. How
Hmm.
will the child chew? And it's also related to some extent with the development of speech and language and sound
Yeah.
emerging
Yeah.
sound. So that whole system doesn't get triggered. So
Hmm.
we don't want to feed them. Our parents have fed us when we were small kids. They had no screens available. So I don't
Yeah.
find it as an excuse that we need to have screen
Hmm.
to be able to feed the child. No, we don't
Hmm.
need that.
Hmm.
Apart from that, for developmentally also, it's a
Hmm.
standard guideline, practice guideline now in pediatrics. Indian Academy of Pediatrics, American Academy across the world have stated
Hmm.
no screen watching for infants till 2 years of age, zero screen time, which would include your TV screen, desktop, iPad, mobile, everything is a screen. So no screen till
Hmm.
2 years of age.
Okay. Okay. And parents understand that. Do they listen to you?
When we tell them what are the
Hmm.
how it can interfere in their development, they do go down to making the screen time zero.
Okay. Okay. And coming back to the behavioral problems among children or the other mental issues that a child faces, how much of acceptance is there among the parents of that the child has an issue?
So the acceptance is now getting better and more. There are a lot of parents who reach out to us on their own
Hmm.
saying that my child has not started speaking. But at the
Okay.
same time, that's more often acceptance is a little better, I would say, in
Hmm.
metropolitan where parents are on their own. They don't want to miss on anything. They are reading so much on internet and Google, and then they, if they find something that, oh, my child has not started doing this, they want to come reach out for help and seek
Okay.
for guidance. Or where pediatricians are also trained, so they also quickly identify. They tell them, okay, go to this person, they and seek help for your child, it will help. So there the
Hmm.
acceptance is slightly better. They are already ready in their head that if something is not happening, we need to work for it. But
Hmm.
when we go to a tier 2 city, there
Hmm.
where we are having joint families, there's a lot of influence of the other family. Also, there the acceptance level drops a little because the decision of the parent there gets influenced, or probably of the mother also sometimes gets influenced by the whole family, where they say, okay, wait, let us wait for 6 months and see. बच्चे देर से
Hmm.
बोलते हैं, you know.
Hmm.
Those kinds of trends are still there, but when you call the whole family, counsel them that
Hmm.
and tell them that, okay, this is what is expected. See, other children, they are doing this at this age. This child is
Hmm.
not doing, we need to do something about it. So
Okay.
then they do reach and they do come to the thing that they need to help the child by doing some therapy.
Okay, okay. Now coming to the normal kids and coming to the pandemic that we had, 2 years of pandemic we faced.
Yeah.
Children faced a lot of, adults also faced, but children faced a lot of mental health issues.
Yes.
So how much of it has now gone back to normal? Has it gone back to normal, or the things are still worrisome?
See, what I have experienced and the
Hmm.
nature of children that I see, the major brunt has been on the early childhood, where
Hmm.
the children got locked up, lot of stress levels. Mothers during their antenatal period were stressed up.
Hmm.
They could not go out. The families were stressed. The stress level in general of the whole community was very high because
Hmm.
of COVID, and
Hmm.
that has definitely taken a lot of toll on the early child development.
Okay.
Middle school children, the moment they started resumed schools, their challenges and their they have reduced to some extent.
Okay.
Even the teenagers, they are now having regular schools from that point. Their
Hmm.
challenges have reduced. Initially, when the schools reopened at that time, a lot of children faced challenges because they
Hmm.
got so used to the online, and then they had challenges covering up to the expectation of the school level. But now that
Hmm.
somewhere over 1 year of going to school regularly, they have covered up and they've like settled back to their routines.
Hmm.
But the
Hmm.
early childhood phase still needs support, I think so. And we
Okay.
can prevent a lot of neurodevelopmental concerns by identifying them in time.
Okay, okay. And now coming to the suppose situation is normal, there is no pandemic, and everything is normal. So, under the normal conditions, what kind of mental health issues do teenagers face? And what would you advise the parents to how to deal with them? Do is it can parents tackle that, or they need to connect with the expert?
Yeah, so routine challenges that teenagers will come across is that they would not want, they can be defiant at time. They are so much influenced by their peer that they are more risk taking at times. Parents can find them getting distracted and their academic performances going downwards, or them engaging in risk taking behaviors like trying smoke, or trying drugs, or maybe alcohol, or some kind of a drug use, or getting indulged in um, inappropriate screen content or social media content, and then getting probably bullied in school, or sometimes self esteem issues can be there. Then there can be anxiety, panic attacks, there can be eating disorders, because they just are so body conscious, they want to look nice, so they tend to modify their diet, and at times they get eating disorders. Girls are seen more with eating disorders, where and because body image perception is there, and they're very conscious of their body image. Then we can also see a lot of early signs of depression, where that we cannot forget that depression is very very common, and it starts in teenage. And teenage mental health में depression is one of the most common uh, mental health challenge that we need to be careful, watchful, and we need to address that in time. So, any signs or symptoms where child is showing loss of interest in their routine activities, not eating, not sleeping, or not doing the things that the child usually likes to do, like their hobbies, executing their hobbies, or there is sudden dip in their social engagement. They are always wanting to be aloof, or they wanting to be locked up in their rooms and not wanting to go out with friends. A change in their routine, or not wanting to do things that they usually like to do. So if parents observe these things, then they must reach out for help, because there can be formal screening, and teenagers at times they want a very confidential environment to open up, or to
Okay.
talk to a third person, where their confidentiality can be maintained. So, and with parent, they have the fear of being judged, which teachers sometimes they have the fear of being judged. So they sometimes try and open up to teenagers who have the same level, who can't guide them. So
Mm.
it's important for us to make our teenagers also aware that there are places, there are counselors, there are professionals with whom you can go and open up, talk about anything. See, they're
Mm.
sexually also developing now. They have a lot of
Mm.
questions around that, and
Mm.
they may indulge in inappropriate sexual behaviors also, just to explore. So talking to some third person who's a professional, who will not judge them, and where whatever they open up with will be confidential, the teenagers can be really helped in a good way. And a lot of nipping of problem can be done right there in the counseling session, and educating parents on various um, parenting strategies with the teenagers. So there is a
Okay.
lot of parenting style which needs to be modified when we are talking of teenage parenting. And by
Okay.
just doing that, being more respectful, accepting of the teenager, it can actually reduce a lot of challenges for the parents.
Okay. You said that there are many cases of depression among teenagers.
Yes.
So,
Yes.
would you like to quantify that? Like numbers?
Yeah. So as- they say one in eight individuals who are in teenage can are predisposed to depression.
Oh my God.
So, and we in our Indian Academy of Pediatric, we run a whole campaign of suicide prevention for our
Hmm.
teenagers,
Hmm.
because depression is the risk of teenagers going in depression is high, and
Hmm.
our country has 40 million teenage population close
Hmm.
to. So we
Hmm.
definitely need to address that. We need to be aware, and we need to also teach our teenagers to
Hmm.
identify who's the best adult where they can go and open up and talk
Hmm.
about, and that they
Hmm.
need to talk about any
Hmm.
challenge that they experience, because
Hmm.
they are more impulsive. Their decision making centers are not yet developed, so
Hmm.
they will impulsively take a decision or an action which can take their life also for a very
Hmm.
small reason, like a breakup with a girlfriend, or a
Hmm.
not scoring adequate marks in one of the exams, or being bullied in the class for being
Hmm.
overweight, or for anything, for
Hmm.
dark skinned or whatever. So those small things, we don't want them to take away their lives for those small concerns.
Hmm.
They can be
Hmm.
addressed, they can be talked about, we can raise awareness to prevent those things. So
Hmm.
that is why it's important to raise awareness and prevent. So we run a whole
Hmm.
mission Kishore Uday and adolescent and youth health campaigns in various schools, educate them,
Okay.
talk to them about healthy living and lifestyle, to
Okay.
prevent these kind of episodes. This
Okay. Okay. What is the prevalence of bullying in schools?
bullying is there, and exact prevalence I'm not really being able to recall at this stage, but
Mm-hmm.
bullying is very common, and it is not usually get surfaced because the children, they are not able to identify, and those who are bullying also, they somewhere are trying to get uh, power control. It's a power control system. A child
Mm-hmm.
who wants to be more in power, they tend to execute that by bullying another child who probably is a little less emotionally weak or physically weak. So there, that imbalance of power leads to bullying in teenagers and in school
Mm-hmm.
years, or even in middle school, there is a lot of bullying. So, educating in general children about bullying and creating anti-bullying squads in school itself can reduce that to a large extent. Because then the teenagers or the children themselves are standing against bullying. They themselves
Mm-hmm.
are against it, so they won't bully at least the others, and they'll make
Yeah.
sure that nobody is being bullied in school. So those
Yeah.
kinds of anti-bullying squads in school can really help.
Okay. Okay. And do children, like you said, that it is important to counsel them at the right time, but are they open to that?
Yes, yes, they're much more open. The teenagers
Okay.
are far more open. They want someone to come and talk to them. You go to schools, we
Okay.
go to schools, we go to government schools, we go to private schools. When we say that we are doctors and we have come and today we are going to talk about this, they are
Huh.
so open. We give them chit papers. Okay, don't write
Hmm.
your name, don't write
Hmm.
anything. Just write your question and put it in the box and serve it to us, and we'll answer your question. And you
Okay.
won't believe there are questions around all topics.
Okay.
So there is a lot of curiosity, but if we
Hmm.
are not approachable for them, their curiosity will
Hmm.
go in wrong direction.
Hmm. So what
So,
is the most asked question? What do
oh, they
they?
want to know a lot about sexuality.
That's the
They have
age.
a lot of issues about issues,
Huh.
not really issues, but
Huh.
questions around it.
Huh. So what do you
About
say? Tell me.
Yeah, so whether it is right or not, even questions around what they experience, whether that's a right thing or not. If they feel attracted to another gender or
Mm,
sex, so is it normal? What do they
mm,
do about it? And they
mm,
have questions about, I am not able to pay attention when I'm studying, my attention
mm,
goes away. What do I do? The
mm,
ex person had said this to me. How do
mm,
I handle this? So the
mm,
small things, and there are sometimes very important questions about self stimulation, about masturbation that they want to ask, but they
mhm,
can't really. They have that those queries around. They're growing up, they're changing bodies, they're changing behaviors, but they don't have answers, and they seek answers in their peer and teenage only.
mhm,
The
mhm,
peer, अब उनके पास भी उतनी information है, they also don't
mhm,
have the complete information. So
mhm,
it's important to give and provide them information and why, what is happening, so
mhm,
that they are also aware.
mhm. So, in such a situation, what would you advise parents? How can parents help?
See, the parents first have to know that now the child has grown into a years, and you can't just go on with the same trend of parenting as we would do in a middle school age. You are supposed to do this, you will do this. So
Mhm,
that will not work. Here you need to partner them, you need to give a lot of respect to them, you need to also be respectful towards their wishes, and be accepting, and instead of pushing through your decisions over to them, that I have asked you to do it like this and it has to be done like this, then it won't happen. But if you
mhm,
give them logical reasoning, sit with them, take their opinion. Okay, what do you think? We want to catch up with our course or syllabus. How do you think you can do that? How can you
mhm,
help? What kind of help can I provide you? So that
mhm,
it should be more respectful way of communication, less
mhm,
judgmental. If they come
mhm,
and say sometimes, oh, I like that boy in my class, so and immediately, oh, तुम्हारा ध्यान सारा पढ़ाई से हटके लड़कों में लगा हुआ है. So that's
mhm,
not the way we are supposed to talk to teenagers. Rather, we said, okay, it's okay, it's normal. I understand. I have also been through this, and we all have experienced this kind of an thing. But
mhm,
then talking it out without judging them as right and wrong. First,
mhm,
listen. The
mhm,
child should be ready to at least come and tell you about it before
mhm.
you start preaching them what is right and wrong.
Yeah, yeah.
And then
But
telling them the outcomes, where is our
mm,
outcomes, informing them the outcomes sometimes is
mm.
just adequate, because they're smart to choose the right outcome.
Okay. Okay. So, don't you think that education, like I'm digressing a little bit from the topic, with education becoming more child-centric these days, there's a lot of importance given to a child, and that is, I personally feel that the balance is gone. Earlier, it was too much of teacher, 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 and now it is too much of child, child, child. So, don't you think that it needs to be balanced somewhere?
It has to be balanced, and
Hmm.
but it is child centric because we are
Hmm.
dealing with the child and the teenager. And
Hmm.
uh, earlier it was more teacher oriented, because see, the culturally the teacher and child relationship was different, and
Hmm.
adult and child relationship are different. Now,
Hmm.
are the teachers also equally responsive, or thinking 10 times before saying something to the child, or they're
Hmm.
just blurting out anything? Are the teachers so much
Hmm.
aware that what are the kind of sentences they are supposed to say to the children, and what is the context they're not supposed to share? So
Hmm.
there, the teachers also need to be on an alert mode. See, we used to beat our children, we used to punish them. Now we are
Hmm.
not punishing them, we are modifying,
Hmm.
we are
We're not
changing.
allowed to.
uh, we are changing in the way that we are rearing our children. So that
Hmm.
is why there is a little shift in being able to understand them in a better way, rather
Hmm.
than just going ahead and letting them be. struggling with their challenges.
Mm. So, do you counsel the teachers also?
Yes, absolutely. We do take
Mm.
teacher training, we take parent training, and we take the teenage training. All these three are done when we enter a school.
Okay. At separately or together?
No, no, we take three sessions, one for teachers
Okay.
and one for parents if the school allows, and one
Mm-hmm.
for teenagers, because the content addressed to each one of them is different. That's
Yeah.
slightly different.
Huh. And where all have you gone? Do you go to only Delhi NCR or the other areas also? Other cities, tier 2 and tier 3?
So we Continua Kids has 19 centers
Okay.
across North India. So like
Mm-hmm.
apart from Delhi NCR, we have it in Patna, Rohtak, Amritsar,
Mm-hmm.
Kanpur, and uh, of course we have Faridabad, Noida, and Ghaziabad, Gurgaon,
Mm-hmm.
Delhi. All these
Mm-hmm.
areas are there.
Okay. And which city throws up the maximum challenges to you?
So since we live in Gurgaon, we practice mostly. We see most patients in Gurgaon, Noida, Delhi. This segment,
Mm-hmm.
and
Mm-hmm.
the peripheral segments where we go less often, as in once in a month. But
Mm-hmm.
the challenge there is that the lack of resources and lack of awareness, like
Okay.
um, lack of acceptance. Like when I go to Amritsar, I found that the acceptance levels are less when you declare a diagnosis. But when you
Okay.
declare a diagnosis in Gurgaon, the acceptance level is much high, and parents
Mm.
very quickly come on to the decision of doing something for the child. There you
Okay.
need more counseling, more convincing for
Hmm.
the parents, because
Okay.
socially acceptance is not there.
Hmm.
People consider it as a social taboo, whereas in
Hmm.
bigger cities now people are not really bothered.
Hmm.
They
True.
want to take care of things, at least that is with them.
Yeah. Yeah. Okay. Okay. So thank you so much, Dr. Narula, for talking to us. And
Yeah,
it has been a very enlightening session for us. I'm sure our viewers will benefit a lot. And
yeah.
we'll come back to you when we have more questions for you.
Sure, sure.
Thank you
Thank you
so
so much
much.
for having me.
Yeah. Thank you
Thank
so
you.
much.
Thank
Yeah.
you.
Bye.